In this video, we're going to review a number of techniques which can speed up your documentation and billing. These include using eClinicalWorks Scribe function, Dragon NaturallySpeaking Medical Edition with Dragon macros, merging templates, reviewing history, adding billing, and doing electronic prescribing of controlled substances. I'm going to show this on two different fake patients. I'm not going to stop and describe everything that I'm doing, but we'll show it one after another. So we begin with Spider-Man, who comes in. He's not feeling well. I visit with him and I determine that he has a common cold. So first I'm going to go to the Scribe tab. If you've never used it before, it's right here, and this allows me to add a bunch of commands which eClinicalWorks can then interpret. I'm going to use Dragon NaturallySpeaking to do it. URI note. Dragon command adds several Scribe commands. When I click Scribe it, it's going to add it right here into the progress note, which I'll show you. Here's my common cold visit. Notice it pulled in all of my medical history that was already there. It gave me some review of systems. It gave me a typical examination for someone with a cold, and it added a diagnosis of pharyngitis. They have a cold, they don't need antibiotics, but I am going to give them some prescriptions, so let's quickly give them 3. Notice I'm using some favorites here, so all I have to do is type it, click it, and I'm done. Let's give him a narcotic cough syrup as well. I've got all 3 ready to go, and now I'm going to prescribe them right now. And I'm going to send them to the Granger pharmacy. I'm going to send all 3 of them, including the controlled substance. Two of the prescriptions have gone, and I get a new window, and this is where I can enter the prescription for the controlled substance, in this case hydrocodone cough syrup. It's signing the prescription right now, and you can see that this has gone. It's now sent to the pharmacy, in this case to Granger's pharmacy here, and it's done. There's nothing to print. It is finished. Now I need to warn him about this medicine, so I'm going to quickly add a warning. Narcotic warning. Narcotic warning. I've said it once. I don't ever want to say it again. I'm going to close this note. I have my 213 visit on there. It's already billed. It's done. And I'm going to lock it. That note is finished. His prescriptions are done. There's nothing else to do. Next, I'm going to demonstrate on our next patient, Wolverine, who comes in for some personal issues, and this is going to be a bit more free text. I don't really have a template for it. He comes in and tells me that he's been being followed by people wearing strange costumes who keep attacking him. I'm going to go back to Scribe, and I'm going to put in another Scribe command. Brief history. This gives me all of my areas of the note that I can dictate in. The patient is a 25-year-old man who complains that he's regularly being followed by people dressed up in strange and colorful costumes, period. They seem to be in movies quite a bit, period. He doesn't know what's provoking them, but they follow him all the time, period. He seems to get injured a lot, but he heals really quickly. No fevers, period. No cough, period. No sore throat, period. Review of systems otherwise negative. He seems to be doing well today, period. Now I'm going to stick this in my note. And you can see there's my discussion. There's my review of systems right there that I said. Notice that it pulled in all of my history that was there before. I don't have any examination in there yet, and it's normal on this guy because if you know Wolverine, he heals really fast. So I'm just going to merge in my default normal, and there it is. And I'm going to give him an assessment here of delusions. Delusions. I inserted that with Dragon NaturallySpeaking, and I'm just going to select it. I think that I'm about done. I'm literally getting ready to walk out the door when he says, "Oh, by the way, Doc, I need to have all my prescriptions refilled. I know I was here 2 days ago, but I lost all my prescriptions. The concern here is, here's Wolverine's medical problem list, and there's his medications. Enough to make any internal medicine doctor proud with that list. There's no way that I want to refill all those, and I don't want to pull in all of his diagnoses. So instead, I'm going to, with one click, bring up this menu, refill all. In so doing, all of his diagnoses are added. Look at this. All the medications are all refilled exactly the way I wrote them last time. They're ready to go, and I could e-prescribe them or I could print them. Now I'm going to bill this guy a higher visit. I could click on my visit code, but because I have a Scribe command, I can do it that way too. 99215. This is another code in Scribe. When I click that, we'll go down to the bottom and I'll show you what it did. It added my 99215 and it attached it to my first diagnoses. And now I'm going to put my follow-up, and I am done with what would have been a really painful note had I had to manually click in and refill each and every one of these medications. That ends it for the demonstration of some of the various techniques that eClinicalWorks can do. I've combined a whole bunch of them together into this video, and now we're going to discuss it.